Hello everyone, this is Dr. Nahid Ali. I am a professor of forensic medicine and toxicology, Suez Canal University, Egypt. In this video, I will highlight the basic concept of minimal risk in research. By the end of this presentation, you will be able to define minimal risk and list a common example of minimal risk research. Let us start by the definition of the minimal risk. According to the Code of Federal Regulation, a study presents a minimal risk if the probability and the magnitude of harm or discomfort anticipated in the research are not greater in and of themselves than those ordinarily encountered in life or during performance of routine physical and psychological daily examination or test. Minimal risk is directly related to the IRB procedures. Why? Because it is necessary for determining expedited review, waiver or alteration of some or all element of the consent, waiver of documentation of the consent, and in pediatric research, the IRB will not approve research without direct benefit to the research participant unless it is minimal risk. The previous definition highlights some inquiries. Firstly, the statement of ordinarily encountered in life. What does it mean? We compare the discomfort in research to having a minor argument at work or with our partner, or losing something important as our keys, or driving a car in a big crowded city. The second inquiry, whose daily life? Average people. Average people is the same in developed and the developed country. Let's say it's universal standard, or it may be population being studied. Let's say it's relative. The third inquiry, which routine physical or psychological examination or test? Having said that, ambiguity of the definition is related to the different IRB's decision. Let us illustrate that by example on asking the chairs of different IRBs about their opinion regarding MRI study without sedation in healthy 11 years old. Nearly 45 stated minimal risk, 35 minor increase over minimal risk, and only 10 stated more than minor increase. Another example, assessing their decision regarding allergy skin testing in healthy 11 years old. 25 stated minimal risk, nearly 45 minor increase over minimal risk, and the 25 stated more than minor increase. The variability in IRB assessment of the risk of the procedure may result in either waiving informed consent for greater than minimal risk studies, or not expediting studies that are less than minimal risk. Having said that, we should consider relative risk standard or objective risk standard. We will illustrate this concept through example on pediatric research. For the relative risk standard, suppose that we are conducting research on children having cancer. So, during the course of their daily life, they are exposed to risk from toxic chemotherapeutic agents. However, when we are adhering to the objective risk standard, we should categorize as minimal risk those risks that average healthy normal children experience during the course of their daily life, as mentioned by the Institute of Medicine, which stated IRBs should interpret minimal risk in relation to the normal experience of average healthy and normal children. Here are some examples of minimal risk research. For example, a study with EEG investigation, or observational study on unidentifiable group characteristic, or research on medical record, or drawing or collecting blood sample according to the international guidelines. Other examples of greater than minimal risk research, including domestic violence survey. Why? Because the research participant may be exposed to psychological risk during recalling of the bad experience or to physical risk due to breaching of the confidentiality. Other example is the experimental study with the investigational drugs with a probable adverse effect on the research participant. The third example includes liver biopsy, which is invasive. The fourth example is the identifiable genetic research, which carries social risk and stigma not only for the research participant, but also for the entire family. This is a small exercise. It is about, is this research eligible for minimal risk category? The example stated that a survey targeting high school students to investigate their attitude and belief about sexuality. What if this survey is carried out in Egypt or in another developed countries? In Egypt, it is not eligible for minimal risk category. Why? Because we consider that as sensitive information and because of the privacy issue. In some developed countries, it can be considered eligible for minimal risk category. Another example, a study will be carried out among the primary school children to determine some developmental standards through measuring, for example, the child weight and the child height. This procedure for sure presents risks that are less than minimal risk. In conclusion, in considering minimal risk, please pay attention to the risk magnitude and the probability. Also, minimal risk may be context dependent. Finally, I wish you like the video and thank you so much.